Hi folks, my name is Dr. Aubry. I'm a chiropractor and a board-eligible chiropractic neurologist. I practice in South Burlington, Vermont, and the name of my business is called Get Healthy Vermont. And the reason why you're watching this video today is because you or somebody you know is suffering from dizziness, vertigo, or another kind of balance disorder. So what we're going to talk about is a brain-based approach to those types of disorders. Now, there are certain rules that I have with new patients when patients come in to go through treatments in my clinic. The first thing is you must be committed. You must be committed to getting well at a level of 10 out of 10. If you're a 9 out of 10, then get serious about getting well and then we'll talk. The second thing is you have to be prepared to make lifestyle changes because what you've been doing in the past has got you to where you are today. And doing the same thing over and over again, well, that's the definition of insanity. The third thing is you must take responsibility for your own health. You must understand that this care might not be covered by insurance. At best, your insurance may cover a small portion of it, but you have to be committed to make an investment into your health. That's what this is. This is an investment in your health. If we proceed, then when you have your exam, I always ask that your loved one, whether it's your husband, your wife, your significant other, your children, whoever you rely on to make your healthcare decisions, that they're there with you because you want to make an informed decision, and you want to make sure that those people are involved in what you need to do in order to get yourself better. Now, how do you go through life with dizziness? What causes vertigo, dizziness, or BPPV? Well, first of all, I want to describe to you exactly what dizziness is. There are two types of dizziness. The first one is called egocentric. That means that you are, or you perceive yourself as spinning. The second kind is called geocentric, where the world is actually spinning around you. So it's as if you're standing still or sitting still and the world around you is spinning, or at least that's your perception of it. Now, feeling lightheaded is not the same thing as being dizzy, but that's not okay. It doesn't mean that everything's okay if you're just feeling lightheadedness. There's another disease that's called Meniere's disease. Now, Meniere's is characterized by the following symptoms: dizziness, hearing loss or a decrease, usually just in one ear, ringing or buzzing in the ears, fullness or pressure in the ears, and it's what we call idiopathic. Idiopathic means that we don't know what the causes are. Now, if ringing or buzzing is happening, then generally what we start to see is an overfiring or too much activity happening in the right temporal lobe of the brain. Dizziness, patients often have other kinds of problems like visual impairments or poor depth perception because you're not really sure about your surroundings. Now, you may suffer increased light sensitivity as well, or have migraines. You may suffer a decrease in memory. And once again, that's your temporal lobe again. Your ears may feel full because the brainstem isn't working at 100%. Now, what does that cause? That can cause you to feel very nauseous. It can cause nausea, vomiting, dizziness, buzzing, fullness, ringing in the ears. You might even have problems with coordination, and you don't want to be one of those people that's just walking and all of a sudden falls down. Then we get to what's called BPPV. What is BPPV? Well, it stands for benign positional paroxysmal vertigo. So this is what happens when you see your family doctor and you tell him that you have dizziness or a balance disorder. He's probably going to tell you that you have an inner ear problem or BPPV, which is benign paroxysmal positional vertigo. He's telling you that you have rocks in your head, almost quite literally. Well, you do. They're just small little rocks. They're called otoliths. Otoliths are small stones that are found in your inner ear, in the saccule and utricle. And what ends up happening is that they're actually in a gelatinous matrix, kind of like jello. So when you move your head, the inertia actually stimulates hair cells, and those signals, they send signals to your brain, which your brain perceives as motion. Now, if they're working right, then you don't have any kind of problem balancing. You can walk around, you can stand on one foot, and there's no problem. But if there's any kind of interruption there, that's going to lead to a problem. And then you end up getting to the difficulties just with walking. That could be a major issue. Now, there may be many causes to dizziness and vertigo. There are things like strokes, hypertension, tumors, and other kinds of side effects from medication. Believe it or not, the majority of side effects on medications, you see so many of them that have vertigo as a side effect. So you want to also make sure that you're talking with your family doctor to make sure that some of these medications that you might be taking are not the cause of your vertigo. Now, the other thing that it could be, the other thing that vertigo or dizziness can be from, is a tumor. Now, a tumor is just that, is swelling. A tumor, when we think of it, people think of cancer, but it doesn't have to be malignant. That doesn't mean that it's a good thing. It's still going to be extremely problematic. And when you do have a tumor in the brain, or even a small one in the inside part of your ear, which is called an acoustic neuroma, this is going to be very problematic for you. This is going to cause all kinds of issues. So you want to make sure that this is ruled out as well. Now, these are what we call hard lesions, or a pathology, if you will. What we're looking for are soft lesions, when the nervous system is not functioning at 100% and we can bring that back up to normal. So as long as we're ruling out these pathologies, as long as we're ruling out these hard lesions, then that's where we're really going to be able to help you out with BPPV. Now let's talk about a stroke. A stroke can affect the part of your brain that processes proprioception. What's proprioception? Well, that's how your body knows where it is in space in relation to everything else around it. If that area is affected, then you can become dizzy. Another thing that can cause dizziness is high blood pressure. And of course, like we talked about a few minutes ago, medication. So if you suspect that it's any one of these problems that we just talked about, or any one of these conditions, then you want to talk to your medical doctor and get it checked out first. But when it's not a tumor or a stroke or hypertension, then it's time to come and see me. When all other treatments have failed and every pathology has been ruled out, call my office. Now, I want to talk a little bit about one of the most popular medications that are out there that doctors are using in order to treat dizziness. It's called meclizine. It's also known as Antivert, and basically what it is it's an antiemetic, and this is something that's used to treat nausea and vomiting. So it's going to get rid of those symptoms that you have from nausea and vomiting, but it's not actually going to fix the part of it that's causing the dizziness and the vertigo. It's just going to get rid of the symptoms associated with the dizziness and vertigo. Now, your MD, your family doctor, may do certain tests like Hall-Pike's test. They might do some Epley's tests where they're actually lying you down and sit you up and turn your head around. We'll do those as well. But when that fails, what else does your family doctor, does your GP, your MD, your neurologist have to offer you? After that has failed, after the meclizine has failed, and the vertigo and the dizziness continues, that's when you want to call our office. Because there might be some other problems going on there. And when we talked about, what I mentioned before, is things like a soft pathology, not a pathology per se, but a soft lesion. When we talk about lesions in neurological terms and functional neurology, especially with regards to things like dizziness and vertigo, we're talking about a certain area of your brain. It's specifically the brain stem, or what we call the cerebellum. Now, there are many causes, like we talked about, of dizziness and vertigo. The inner ear rocks might be one, but there's always that component of the cerebellum. The cerebellum controls coordinated movement, it controls balance, and it also terminates your eye movements. So this is very, very vital for cognition. Now, you have a right cerebellum and you have a left cerebellum. There's two sides to it. So they both have to be functioning at 100% for everything to be working well. If one side is working better than the other, you're going to start to see all kinds of symptoms. Now there are three lobes to the cerebellum. You have your anterior lobe, your posterior lobe, and your flocculonodular lobe. Now if one side of the brain is, or one side of the cerebellum or the brain is overfiring, then the other side is going to be underfiring. And what happens is when you have an overfiring of one part of the brainstem, what that does is it stimulates an area called the NTS. Well, the NTS stands for the nucleus tractus solitarius. And what that does is it actually sends a signal down into your gut. So it activates your vagus nerve. Now, people hear about getting vagal, or you might have heard the term vagal syncope. Basically what that means is when that vagus nerve is stimulated or overstimulated, and that goes down to your gut, that's going to give you that nauseous feeling. That's going to give you that feeling like you want to throw up when you have that dizziness. So think of a cerebellum as a spinning top. If it slows down and falls to the side, that's when you're going to start to have a problem. Okay? So we want to make sure that we have the cerebellum functioning or firing at the right rate on either side. When we have a decreased frequency of firing, when the one side is not working to the same side as the other, then you're going to start to develop symptoms. Now, the cerebellum needs certain things to survive and for the brain to function properly. Your brain needs fuel and activation. Now, fuel comes in the form of glucose or sugar and oxygen. And activation comes from different movements or input that's put into your nervous system, whether that's from physical therapy or from exercise or movement. One of the treatments that we do in our office that works really well for any kind of neurological conditions, and specifically for symptoms of BPPV or vertigo, is using an oxygen concentrator. Now, an oxygen concentrator is 90 to 95% oxygen. It's not like an oxygen tank. This is actually taking the oxygen out of the air, and it's concentrating it into a mask or a cannula that's going to allow you to sit down and use what's called an upper body ergometer, or it's kind of a little bicycle. I'll actually grab one here. So what we see here is an upper body ergometer. So an upper body ergometer is kind of like a little bicycle for your arms. And as you pedal this, this is going to stimulate the brain or the cerebellum to function properly. And when we combine that with the actual oxygen concentrator, that's going to help to get you better. So that's one of the treatments that we do here. Now we also do unilateral adjusting. Now, if you've been to a chiropractor and you've been adjusted, we want to make sure that we're getting the maximum benefits of the treatment. And when it comes to neurological condition, what we've noticed is that unilateral adjusting, or adjusting on one side only, is going to benefit you the most. Now, you hear about one side of the brain controls the other side of the body. That's definitely true. And we don't want to overstimulate both sides. We want to make sure that everything is equal. So if we see a deficit, if there's a deficiency in one part of the brain or in one part of the cerebellum, we want to make sure that we bring that back up so that we don't have any long-term problems there. Some of the other therapies that we might do are a caloric stimulation. Caloric stimulation is basically what we do is we put some warm water into one ear and it bounces off the eardrum and comes back out. Now that stimulates those kinocilia, the stereocilia that we talked about before, and it actually sends a signal back up to the brain. It's a very, very powerful way of stimulating the cerebellum. Now we can also do that with a hairdryer because we just want to make sure that we warm that gelatinous substance up. Now some of the other things that we can do are eye exercises. Eye exercises are also going to stimulate the brain. Or auditory stimulation, listening to music in a certain key in either the right ear or the left ear, depending on the problems that we find. Now there are other therapies like visual imagery. So basically you would imagine yourself doing specific things. Let's say I told you that to imagine yourself floating. Well, what happens is your brain knows that you can't float. So it actually sends signals to the cerebellum and to the brain. They're called feed-forward and feedback mechanisms. But anyway, the important thing to realize here is that your body doesn't understand, it doesn't know how to float. So it starts to stimulate different areas of the brain, and these are some of the therapies that we can actually use that are very powerful. Now, in treating patients since 1999, I've never come across a pill, and with the 500 to 800 doctors that I communicate with on pretty much on a daily basis, there's nobody that's come across a pill that fixes everything for vertigo and dizziness. It just is not out there. So the main things that we want to focus on are getting your cerebellum functioning, if that is in fact the case. We want to make sure we've ruled out all the other pathologies, and we want to make sure that we've done a complete and thorough neuro evaluation and come up with a proper treatment plan for you. Now I want you to imagine something. Imagine you were on a boat and you saw somebody fall overboard. What would you do? Would you help them out? Would you throw them a lifeline? Well, what I want to ask you is, if you know somebody, whether it's yourself or whether it's a friend or family member that might be suffering from this, throw them a lifeline. Let them know that you saw this video, show them this video, point them to our website, let them come in and talk to us for a consultation, or you come in yourself, because we can help you. What's the worst that can happen? The worst that can happen is you stay the same. So the main thing is you want to make sure that you are taking care of yourself and you're doing everything in your power to make sure that you get better. So what I'm offering you here today is I want to offer you a chance to come into the office and see if in fact there is something we can do. Because I can talk to you all day long. That doesn't mean what I'm doing is right for you until we look, until we sit down and I consult with you, I go through a thorough history and an examination, we do any additional lab tests that might be needed, do a thorough neurological evaluation, and then come up with a treatment plan specific for you. I'm not going to tell you that this works for everybody, but we've got to, the only way to know that is if you come in and make an appointment and talk about what's going on. So, I'm looking for people, sick people, people who have seen other doctors that have been unable to help. And not just for dizziness either, but there are other things that we help with. People that have had strokes, people that have thyroid problems, that have fibromyalgia, and besides vertigo, peripheral neuropathy, chronic pain, sciatica. If you know anybody that's suffering from these conditions, please let them know about our office. So, if you go ahead and schedule an appointment within the next few days of viewing this video, I'm going to cut the price down. Normally a consultation in my office is $100. I'm going to give it to you for $49 for viewing this or for telling a friend of yours. I think that that's a pretty good deal. Now, you're doing your part by actually taking part in this, by showing some kind of initiative. So I want to show you some initiative that I want to do what I can to help you. There might not be 100% coverage with your insurance, but we offer other plans. We take credit cards, we'll sit down, we have a third party that can come in and help out called Advanced Care. You can look it up online. In the meantime, go to our website, www.gethealthyvermont.com. Unless you've seen this on the website, you might have seen it on YouTube as well. If you have any questions, give us a call, area code 802-230-4678, and go ahead and book an appointment. I thank you for your time, and I look forward to seeing you in the future. Thanks.